Hi everyone. Today I want to introduce you to our mental health resources that we'll have in both offices. In each office we'll have, in 3 of the pods, we'll have an accordion folder that you might have already seen in some of the pods. It's just updated. And we'll have a mental health resource notebook. In the accordion folder, you're going to see several sections. We're going to start with, in here you'll find the PSC for the parent and the child. You'll find a preschool PSC, which you may or may not want to use, but it is a good tool. You'll see the SCARED for the parent and child, the anxiety screener. Burns, that we use for teenagers for anxiety. The PHQ-9, the depression screener that we all are using for our adolescent checkups as a universal screener. And then the Columbia Depression Scale for parent and child, you will have for the parent of a female child and parent of a male child in that section. Then you'll have the short mood and feelings questionnaire we use on younger children to screen for depression, parent and child. And the aggression scale. And then we move into the Vanderbilt teacher and Vanderbilt parent. There are no follow-up Vanderbilts. We're going to strictly use the initial screening Vanderbilt form for follow-ups. It's a much better tool. It allows you to continue to look at the externalizing behaviors of oppositional defiance, but also the internalizing behaviors of mood, anxiety, and depression. So you're ongoing going to be able to keep screening your kids with ADHD to see the serial screeners to see if their medication is working, but also if the comorbid development of other mental health conditions. So you have the Vanderbilt, that's important. The CRAFT, which is a great screening tool for substance use, drinking, driving in teenagers. The Children's Global Assessment Scale, it's really just a scoring tool from 1 to 100 that if you had to call VMAP and you wanted to give an idea to the psychiatrist you were talking to what the global assessment score was, you can read it and see where your patient might be, where your teenager might be. Finally, in this box, most important, I think, is the ASQ. If you do screen for depression and you have someone that screens positive for suicidal ideation, you do want to know how serious and what you need to do about that. So you will have them fill out this screener, and then we'll show you some resources that we have in the resource book. And then lastly, you have the adult ADHD screen that I use for older teenagers and adolescents, because the Vanderbilt screens up to age 12, and it's really not appropriate often for your older teenagers. So that's a really good tool. So that box hopefully will be kept up to date here. It will be kept up to date by Mel, and maybe she'll be kind enough to do it in the other office. Just saying. Okay, and then we have this wonderful binder. Thanks to Mel for all her help, by the way, with this project. This has been a labor of love. This is a mental health resource binder that has 4 sections. The first section has scoring for your screeners that you'll need to. Some of the screeners actually have scoring written right on them. First one is the PHQ-9, and then the short mood and feelings questionnaire is on the back of that, followed by the depression scale, the Columbia Depression Scale, and the SCARED, and then followed by the pediatric symptom checklist, the PSC-17, and the preschool PSC scoring. Then lastly in here we have the Vanderbilt. Okay, and the adult ADHD screen, which I think is nice too. Again, I think you'll find that useful for the older kids. Second section is all about suicide. The ASQ, how to interview the patient, how to make a safety plan, how to determine disposition, and what resources you need to provide to all patients with suicidal ideation. And then that continues on the back. Safety planning for children and adolescents for the primary care provider, just a really nice handout. And then finally, SAD persons. We used to use this all the time before the ASQ. Some people still like it. It's just a really nice way to think about who's really at risk for suicide. And you can see a scoring for that on the back. I used to use that a lot and put it in my notes. Then you have pocket folders in each section. And if it's a pocket folder, it's because there's a handout you can give to the patient. So patient screens positive for suicidal ideation. They're not someone you're going to send to the hospital because it's not imminent thoughts, and you can safety plan with that family. You can give them these resources that have important numbers, especially the text home to 741-741. That's a good one to have in your head and teach to your teenagers. Okay, so that hopefully these pockets will be generally filled and someone won't take the last one without refilling it, because it'll just make it very difficult. Here's a monitoring safe house sheet that just goes through, you can give to parents for them to begin to think about what a safe home looks like if they have an adolescent who's at risk for suicide. And again, that's a pocket, so you can give that to the parent. Followed by how parents can talk to their kids about suicide. Just a really nice handout that gives them a framework for how they think and interact with their adolescent when they're worried about some serious depression and suicide. Last one is just those home safety recommendations you can give to the parent. All right, the third section continues with some parent resources around other things like counseling, CR2, the Children's Regional Crisis Response Team, which is 24/7, 7 days a week. If you have a family in crisis and you need to get somebody out there, this is very helpful, and you can give this to the parent. Followed by the Children's Services Act. I've often spoke about that. You have a family you're really struggling with and you've tried everything and they need more intervention. This gets enacted at the school level. The social worker does put in the initial paperwork, so this family goes into getting a family assessment and planning team that'll help with things like counseling, mentor, Parks and Rec services, and just over an IEP and counseling at the school. It's sort of a wraparound services for the child, okay? And then the last thing I put in here was the community service boards for, I've talked about adults with developmental disabilities, needing to have them present to apply for Medicaid waivers. And this form in the back here that you can give to your patients with developmental disabilities does have the 3 types of waivers on the front, and on the back, your local community service boards. Okay, that is our logo on the bottom there. So, all right, and then the final section is really just resources for the providers, and that here is the Virginia Mental Health referral list for the county emergency numbers. I was thinking eventually I'll probably put a list of the psychiatrists in here, but need to really take a close look at that list and maybe talk with other providers and see if they have other people on the list. There's an algorithm in here for depression that you can use to help you with your judgment for depression, treatment, and planning for your patients. There's also a VMAP, the sheet for VMAP, how to call for a VMAP help, psychiatrist to consult with about our patients, and how VMAP works. And then the last section is really just coding tips for behavioral health visits. And I did put information in there on the black box warning, how to talk about, really it's not black box, it's boxed warning, how to have a conversation about the boxed warning in case you need a reminder before you have that conversation with the parent. And the last is mental health levels of care, inpatient, partial hospitalization, intensive outpatient. So they give you an idea of how the levels of psychiatric care are deemed within the system. Okay, so that is our resource binder that I hope you'll find helpful, because it's kind of everything in one stop. And we can evolve it over time and add to it, remove things, but I think it's going to be good to go, so we can get started. So each section in Fairfax and in Alexandria, well, 3 anyway. There'll be three binders and accordion folders in Fairfax and 3 in Alexandria. So good luck, everybody. we're here for each other. We're a team, and these are just resources. Most important is that we have each other to lean on and help with difficult patients. That's it. Have a great day.